Hello, all, and welcome to day two of Impact Health 2021. For those of you joining for the first time today, Impact Health 2021 is a conclave put together by IIM's Healthcare Alumni Special Interest Group and TIE Mumbai. I'm Shweta Mani. I'm an alum of IIM and a storyteller by profession, and I, along with Naveen Raju, the Executive Director of TIE, are your hosts for this evening. Yesterday, in a series of engaging sessions, we discussed why healthcare innovation is both urgent and important from an Indian context, why the pharma industry in India is ripe for disruption, and what sorts of ecosystem models are thriving in digital health globally. In our VC panel, we heard from both Indian and international VCs firsthand about what companies are looking for funding should be doing, what mistakes investors usually make, and some out-of-the-box ideas for scale that some of their portfolio companies are applying. The startup pitch session saw two innovative startups make their pitches, and two awesome, inspiring children present their product pitches as well. As we head into day two, some hygiene factor announcements. If you face tech issues with your Townscript interface, please put it in the chat, and the Townscript tech team support team will reach out to you and solve your issue for you. If you've pre-registered with us, you should have also received an option to view the session on a Zoom webinar. If you have any questions during the sessions, type them in the chat box and we will try to get them answered, subject to time. Having said that, let us now proceed for the first session today. Our first session today is on corporate innovation and has some of the leading corporations in pharma and medical devices joining us. The session is moderated by Professor Vishwanath Pingali. Vishwanath Pingali is a faculty member in the economics area at IIM Ahmedabad. His main research interests include health economics, digital markets, and experimental and behavior economics. His research has appeared in several leading peer-reviewed national and international journals. He actively contributes opinion pieces to newspapers and magazines on issues of current interest. Prior to joining IMA, Vishy worked as an antitrust consultant in Boston, in the US, and as a health economics at Dr. Reddy's in Hyderabad. He has a master's in quantitative economics from ISI, Calcutta, and a PhD in economics from the Northwestern University, USA. Professor, I hand this over to you now.
Thank you, Shweta, for the nice introduction. And I'm really looking forward to the panel discussion today on what makes startups tick, what makes startups scale up. And we have with us three amazing speakers to talk to us. First one, it's my pleasure to talk to Sanjay Murdeshwar, Vice Chairman and Managing Director, Novartis. Then we have Umang Vohra, Managing Director and Global CEO of Cipla. And the third one is Shravan Subramaniam, President and CEO, GE Healthcare India and South Asia, and Managing Director, Wipro GE Healthcare. Welcome to all three of you. It will be my pleasure to talk to you about a wide variety of topics. So let me, I'll probably ask each of you to introduce yourself a little bit. I'll read out your introduction, but I'll have a specific question at the end of the introduction for you all to talk and get the conversation going. Sanjay, you first. Sanjay has joined Novartis in India in May 2019 as country president and managing director. Before joining Novartis, he worked with AstraZeneca based in Maryland, USA as global vice president. Sanjay had the opportunity to work with various markets around the world and in various functional and commercial areas of the businesses at the country and global level. He has a bachelor's degree in chemical engineering and an MBA. Interestingly, Sanjay's leadership values are simple, and he focus on defining simple, clear, and executable priorities is the key to everything he does. He strives to enable a culture which is curious, unbossed, and inspired to reimagining medicine. He loves science and believes deeply that continuous innovation is critical to better human health and prosperous society. Welcome, Sanjay. And in order to start us off, I have a question for you. If you could just describe your journey. But the specific question I have for you is that Novartis, we were talking about this idea of Novartis and biomes and how they encourage startups. Specifically you said that India is one of the places that Novartis is concentrating in the last few years, specifically with Hyderabad being their base area. If you could start us off, Sanjay, with a bit of a discussion on that. Specifically, what do you look for in a startup to make it a part of Biome? I mean, what makes it tick for you, saying that this is a startup that Novartis would like to mentor?
First of all, thank you so much, Rishi, and everybody. Really appreciate it. Again, it's a pleasure being with the team here and discussing topics. As I said, I've been with Novartis for a couple of years now, but I've been with the pharmaceutical or the healthcare industry now for a couple of decades, mostly in the US, in Europe, and in Asia too now. Coming back to, I think, addressing very specifically what you said, Rishi, I think it really all started from the fact that around 2.5 years or so, or maybe around 4 years or so, Novartis actually set out on an ambitious digital transformation plan for Novartis to really become a leading medicines company powered by data science and digital technology. The idea was, how do you approach drug discovery as a computational challenge and to bring drugs to market much, much faster, and really transforming the way we engage with patients and healthcare practitioners. And of course, we are therefore on the journey of big on data and digital. And this is because of three basic thoughts that we had. It's number one is just from a discovery perspective, there are really 20,000 genes in the human body, where just 60% or so transcriptome are non-coding RNA. There are 20,000 known proteins, but only 3% are targeted by drugs today. There are 10,000 known diseases, but only 500 diseases really just have treatment. So we need to find solutions for all of this. And therefore, that's where I think what we thought was, how can drug discovery become a computational challenge or different value chains of a healthcare company? And that's where Biome comes in. So what Biome is really is, it's a digital innovation hub. We have one in San Francisco, there's one in Paris, one in Hyderabad, and another in Singapore. And what we aim to do is boosting the connection and interaction between Novartis and partners from across the digital ecosystem, from nimble startups and academia to be the biggest players in the industry. And our idea here is very simply to ensure that how can we try to solve each of the problems. So what we do is that if you go onto our Novartis Biome site, we will put questions or problems that we have in different parts of the value chain. It could be a technological question, or it could be a question in data, and in the most efficient and effective way we can do it in manufacturing, in discovery, in clinical development, and so on and so forth. And what we hope is there are startups all out there who can try to solve our problems for us. So it is not just anybody coming up, but we have very specific problems that we want to solve. And are there somebody out there who can bring up these ideas, and then we can help scale up these ideas that can solve our problems and hopefully also help the startup. I mean, that's the concept of what Biome is about. And therefore, the most important element that we look at when we have different companies work with us is that do they have a couple of things? Number one, the talent. I think what we believe is that technology is sometimes overrated. If the talent is there, technology usually follows. So is the organization full of talented people who can know how to solve problems? So I think that's number one. Number two is that, are they really addressing the problem that we have said that we want to solve for? And as I said, it could be any problem in the entire value chain, but it's more data and digital driven. So are they really, really, really addressing a problem? Because we can then help scale them up. I think that's not an issue, because once we know there's a solution to a problem, we work with them in scaling them up. But are they willing to scale up? Do they understand that I think an idea needs to be converted into a P&L and a balance sheet and a cash flow statement? Because at the end of the day, I think I think the problem needs to earn money rather quickly. So it's not over a long period of time, if that helps.
Great. Thanks, Sanjay. Let me bring Umang on board here. Umang Bora has been Managing Director and Global Chief Executive Officer of Cipla since September 2016. Umang joined Cipla in October 2015 as its Global Chief Financial Officer and from January 2016 to August 2016 was Cipla's Global Chief Operating Officer. After gaining degrees in engineering and marketing and finance, Umang was associated with companies such as Eicher Motors and PepsiCo. Prior to joining Cipla, Umang was head of North America business for Dr. Reddy's Laboratories. Through his previous roles in India and US, he has built a distinguished career spanning almost 2 decades with deep understanding and experience in various aspects of global pharmaceutical business. Under Umang's leadership, Cipla has built strong momentum in its home markets, augmented its capabilities, strengthened its core, and shown significant improvement in its operating margins and profitability. At the helm of Management Council of Cipla, Umang's big picture agenda is to define and execute Cipla's strategic growth roadmap and geographical footprint, identify the next levers of growth, invest in innovation for future, and build the right orientation. Recognized as an action-oriented industry leader, Umang is a firm believer in the power of agile business models, disruptive technologies, data-driven analytics, and a future-ready workforce with a view to shaping the healthcare ecosystem. I'll also tell you interesting fact, when I was working for Dr. Reddy's, Umang was the CFO of Dr. Reddy's, so therefore I did have the pleasure of meeting Umang at a couple of meetings during those days itself. So it's great to reconnect with you, Umang, once again. And the question that I have for you is that you've been talking about future workforce. You've been talking a lot about heavy transformation that we're seeing in healthcare ecosystem. So the question for you is, what is the future of workforce in the healthcare ecosystem that you're talking about? And if I may ask you further, what kind of ideas are coming up in this to support the startups? Or what kind of
Well, thank you so much, Vishy.
Hi, Umang, please.
I'm sorry I interrupted. I thought you done
Over to you,
a bit of a lag. But thank you, Vishy. Thank you for having me, and a pleasure to be here with both Shravan as well as Sanjay and yourself. So let me start, Vishy. I think we defined our agenda in terms of just trying to figure out and what we're going to do in terms of innovation around 2 business parameters, right? Or 2 axes. The first axis is business model innovation, which a lot of us, frankly, are very well aware of, right? These happen in terms of disruptive models. Some of those guys are going IPO, have $1 billion worth of unicorn value, and it makes some of us on this call seem really odd because we've been running organizations for years and still haven't reached the type of visibility that some of the new business models are reaching. But that's the power. That is the power of business model innovation if done right. And the second axis that's Cipla hopes to attention is the axis of innovation, right? Where we're trying to basically get new technologies, where we're trying to basically partner with individuals who have smart ideas around this space. So they're more product-based, they're more science-based, as against the first axis, which is more business innovation and model-based. I think these are 2 areas we invest in. We had an initiative called Innoventia, which 2 to 3 years back identified for us 2-3 startups, which Cipla took, which Cipla partnered with, and these are really going well. Both ones in the area of distribution in India, the others in the area of patient services. And we want to keep furthering this. Actually, we had also made an investment in South Africa. So we have 3 of those investments. And our current focus is really on science and technology. But you ask a very important question on the future of workforces. And, I will say this, Vishy, I'll give you an example of what I believe is going to be the future of work. I think, different organizations are different, but I'll illustrate a simple point. It takes me longer to book an air ticket when you work in an organization than when you do it personally off your smartphones or off your tablets, right? So, let's just step back for a minute. That is the paradigm shift we need to bring into how the future of workforces will evolve to, right? I don't expect my team or me to be approving through a complex hierarchy of SAP and all the other travel portals that come with it. I just think people should A, have the empowerment, B, the responsibility to do things the way they would do it in their personal life. So I actually think life is easier outside of corporate organizations for many of us who work here today, right? So I think that is where the future of work is. It's about simplicity. It's about convenience. It's about working, as we all say, from anywhere. But it's also about a huge amount of accountability, which I think digital allows us to provide and solve for the people. So I think that's that's where it is. I mean, keeping it in very simple, it has to take the best of the gig economy, right, which is where people have the ability to do it, as well as the old economy, which is how we've just been used to how to work. So I'll stop there, but great to be on the panel with all of you today.
Thanks, Umang. I understand the two very important dimensions that you talked about: business model innovation and emergence of new technologies, both products as well as the way you deal with the products. Let me, with that, bring in our third panelist, Shravan Subramaniam, President and CEO, GE Healthcare India and South Asia, and Managing Director, Wipro GE Healthcare. Dr. Shravan is the President and CEO, GE Healthcare India and South Asia, and Managing Director of Wipro GE Healthcare based in Bangalore, India. Shravan has over 15 years of corporate and healthcare experience. A physician with a passion for diagnostics, he is particularly keen on promoting precision medicine and the use of technology in healthcare. His career spans leadership roles in global pharma and medical devices organizations, including Roche and Novartis, among others. At GE Healthcare, Shravan manages a P&L of 800 million, with 4,500 plus member workforce spanning 6 countries. He is responsible for GE Healthcare's commercial operations in India and South Asia and acts as the site leader for GEHC's India Engineering Design and R&D Center, 3 manufacturing sites, and supply chain operations as MD in GE joint venture with Wipro and Bharat Electronics. He's a doctor from Madras Medical College and holds a master's degree in health administration from Cornell, where he previously served on the alumni board. I think some of the more interesting things is that he enjoys scuba diving and golf and spends time with his wife and children, Anushka and Adit, in Bangalore. So Shravan, I do have a question for you as you introduce yourself. You talked a lot about precision medicine. I think almost everyone who's worked in healthcare now understands that precision medicine is the new wave that's coming up. If you could talk to us about what kind of startup opportunities you see in this precision medicine and what is it? So just for the lay person terms, if you could even talk about what a precision medicine means in the first place, and then maybe talk about the opportunities that are available out there for people to look at.
Thank you so much, Rishi. It's great to be a part of this panel, and of course I know Sanjay. I'm from Novartis myself, and fabulous culture of innovation there. And Umang, if I could bottle up what you said about the airline ticket booking and what we're trying to do, we keep talking about being unbossed and creating intrapreneurs, but then we just add more and more layers to it. So I think this is definitely a trigger for me to have a conversation with the team. Thank you for that. Hey, Rishi, so precision medicine and personalization of healthcare, this is not new, by the way, right? It's been around forever. It's just that its application has been changing over time. To give you an example from half a century ago, where probably both Novartis and Cipla have had a play, is if you consider antibiotics, you do a sensitivity test first before you give an antibiotic. You don't just blast a patient with any antibiotic. So that was in pretty broad terms. Bring it back to say 25 years ago, when I was in medical college, a patient with say lung cancer, with the available technology, then you could maybe say, okay, this is a small cell lung cancer versus a large cell. And but then the treatment options were not very different from each other. You blast the patient with either chemotherapy or radiotherapy. Both of them are fairly nasty, and the outcomes were not great regardless. Right? The 5-year life expectancy was not tremendous. Now you look at today, if you take said same lung cancer, there are dozens of different genetic and molecular varieties of lung cancer within small cell or within non-small cell. And then amongst those, there are quite a few different treatments or treatment combinations, depending on the age of the patient, depending on their history, depending on their genetic makeup, etc. And it's well nigh impossible for any one clinician or a set of clinicians to memorize the whole set and figure out what to do for that particular patient based on all of this. And this is where we're starting to use a lot of data, a lot of learning tools, a lot of computational tools, a tumor board approach to come up with very specific treatment programs, which we're calling precision medicine. The paradox here is that if you want to treat N of 1, you need data from a whole population of a particular type of disease within a particular geography or particular age group. So that's what we are balancing here. Now, to narrow your question further, you were talking about the startups. And since GE Healthcare is very excited and very interested in this space, one of our big learnings, Vishy, has been that no one company can do this alone, right? We've tried to do a lot of things. We've had some evolutions and revolutions in imaging, but how much further are you going to go? I mean, we started off with a single slice CT and it's gone all the way up to 16, 32, 128, 256 and whatnot. But that's not going to have a huge incremental change in patient outcomes unless you're able to overlay that intelligence with what you're getting from genomics and what you're getting from perhaps the biome and other places also. So with that in mind, GE has started over the last couple of years a startup accelerator called Edison, the Edison Accelerator. And depending on the flavor of the season, we look at different, onboarding different kinds of startups. It could be in the genomic space, it could be in image pattern recognition space. And typically we are doing a lot of work in oncology, but not limited to that. Oncology just lends itself more easily to personalization at this point, but it could really be in anything. And here we offer the ecosystem to startups. They could be digital or hardware startups. And we sort of allow them to play with our systems and with our healthcare network, not just within India, but globally. And we do the diligence, and then we help to onboard and eventually commercialize the startups wares, if you will. So this is just a very quick sort of example that we're doing. During COVID times, we launched a product called Predible, which offers for radiology, for the CT scan lung interpretation. It's able to accelerate the interpretation of the CT scan lung for a COVID patient and cut about 50% of the radiologist's time. That's just one example, very specific example of startup working with GE in a clinical application all the way to commercialization. Thanks, Rishi.
Thanks, Shravan. Very interesting. Umang, I'll come to you. I simply somehow cannot get rid of that airline example that you just spoke. Talk to a person from a public institution and you tell them about the difficulties in getting the bills cleared. Thank you very much for that. But I am going to, it's a nice way to end the weekend, by the way. But nevertheless, start the weekend, by the way. But nonetheless, the question is, you mentioned a very interesting thing. You talked about sustainability of business models. In the startup world, where we are seeing obscene valuations that are coming up right now without a single cent in revenue, one starts wondering what that business model sustainability is all about. There's one side network economics, there's another side platform markets, digitization, blah, 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 blah. But what is the sustainability of business model that you're talking about? Just to take the term out of Shravan, if you could give me a precise answer here with some examples, that would be really great.
Okay, well, let me try. Shravan has the eloquence and the articulation that maybe I don't have, but let me try. I think it's tough to emulate what Shravan said. But here's the thing. I think let me start by being a little philosophical, and then we'll get to the specifics that you want. Years back, I had the opportunity to listen to Clayton Christensen. He recently died. He was a leading professor who spoke about disruptive innovation, right? And I've had the opportunity, the good fortune to listen to him. And one of the things Clayton said right, which struck us is, disruptive innovations, they start at one end of the industry spectrum, and you don't realize it's disruptive until you basically see a train moving down towards you, right? And they satisfy some need for some basis of customers, and it comes very fast towards you. Think of it, Rishi. It wasn't up till about 5 years back where the same questions were asked about right? Everyone's Amazon, not India, but the Amazon global.
I think if you
right?
could,
But they did something truly disruptive in terms of. I'm
you
sorry.
could
Did you?
repeat. I think
Did
we
I
lost
lose?
you for a few seconds in the middle. So
Okay, where did you lose me? Do you? Can
so you were
repeat
talking
that?
about Clayton Christensen's
Yeah. And I
discussion
said,
on
so
disruption.
Clayton. Yeah, and Clayton always said, I'm sorry if I'm repeating it, but Clayton said disruption starts towards the one end of the industry spectrum and very quickly hurtles out towards you, right? And it satisfies some need right at the end of the disruptive chain. And if you look at Amazon, right, till about 5 or 7 years back, people were asking the same question of Amazon. What are the unit economics of this company? When will it ever make money, etc. Right? But today it's reached a scale where no one asks this question of whether they will be able to make the money or not, simply because the scale and the heft that moves through them allows them to even tweak a small model to get a huge value out of it. So my point on sustainable business models is that I think it's a function of the unit economics, right? Where your unit economics must have the ability, if not now, but must have the ability to create a positive outcome in the future. And the second is that I think scale somewhere, especially in a market like India, becomes very important. So the right idea, the right unit economics, which can be repurposed, and the huge scale that can come. I think that is probably the three ingredients of business model and disruptive innovations going forward.
I understand that, but I've also asked you for a couple of examples that you're talking about in terms of the startups that you're working up, with
Yes,
where you thought actually that you saw, this business
I'm
model
happy
innovation. Yeah, please.
I'm happy to speak about one that we invested from a business model perspective, and it's a very interesting. I won't name the startup. I don't think anyone can go to our website and do it because I'm talking on behalf of them, right? But let me tell you why we got drawn to this startup. This startup basically was talking about distribution within the tier 3 to 6 cities in India. And all they wanted to do, Rishi, was to reduce for every retailer the whole model onto their smartphone, right? So the retailer could order from the smartphone, the retailer could watch where his inventory was, he could get loyalty points out of the smartphone, everything, right? And remember, the problem in India of tier 3 to 6 cities is immense, right, in terms of distribution. So when we invested in this startup, it was a small investment and we weren't very clear that they would make the cut. But, fast forward to 2 years later, which is now, you won't believe the scale this startup has achieved in just the interiors of India. They're boasting now of almost 4 to 5 lakh number of people who've actually signed up for this. We have visibility today. The startup has visibility of the ordering pattern of each of these people, of what's being consumed, right? Of how the loyalty points are being earned. So it's just amazing what you believe scale can do, especially if you're offering a solution which is more convenient, more real time for a set of people that you attention. And now the unit economics of that startup are beginning to work out, right? Because all the startup needs to tweak is a % here or there, and it begins to work out. And my guess is, we see e-pharmacies in India. Until 5 years back, nobody thought their unit economics would ever break even, right? I mean, there's still a question mark on it. But I believe with a small tweak in one or two of those variables, right, and some of those may actually hit manufacturers of drugs, I think the unit economics will suddenly begin to look good. So I think it's a thing of waiting and watching. The only thing is making sure that with the variables you could tweak, your unit economics would make sense with the scale that the startup begins to acquire. So that's a very specific example of a distribution company that we invested in.
So basically, one of the modern day misnomers, if you will, is that scalability and digitization probably go hand in hand. I mean, I think people confuse one with the other. There may be a correlation, but that's not always true. Actually, I think the recent Harvard Business Review article also is talking about limitations to network economics that people have used and abused. In that context, let me actually, bring in either Shravan or Sanjay, and maybe I'll come back to you also for your views. When you're talking about scalability, what do you think in a startup, what makes that startup scalable, especially in the healthcare context? Because, in India, we are at a very interesting juncture. I mean, quality is needed, scalability is needed, but you need to do it in an affordable way. So therefore, I'm going to combine the three of them: quality, affordability, and scalability. And maybe ask Shravan and Sanjay to comment on, where's the challenge actually in looking at this holy trilemma, if I may call that, right? Quality doesn't come cheap, but somehow we have to deliver quality, scalability with affordability.
Yeah. So, Vishy, maybe if I can start. Affordability is a very loaded term, right? Affordability is not necessarily cheaper. You need to think about what is the overall outcome, what sort of clinical outcomes are you looking for, and how much it's going to cost. So, since of course Sanjay is sitting here, I can give the example of chronic myeloid leukemia. It would have cost about 10,000 rupees to treat it in the 1990s. In today's value of 10,000 rupees, 25 years ago. But then the outcomes were very shabby. But today you can give a patient a nilotinib or imatinib, and they're going to outlive most other diseases or patients very comfortably and almost have a normal lifespan to everyone. But of course, they're going to pay a lot more. So what is affordability? You need to put that in the context of outcomes. Sanjay, I hope you don't mind my taking an example from there. So we'll come to that in a second, and maybe Sanjay can speak more. But I look at it in terms of access. How can we deliver more access of high quality care to more people? And then that's where you have affordability, etc. But you need a technology play, you need a skill play, you need a logistics play. So there are so many things that go into making a product or a service affordable and scalable. I think there are some fundamental differences between what we have in, say, markets like India and other countries, because in India, the healthcare system is so fragmented. Even within a city, within a geographic area, it is fragmented. Within a health system, it is fragmented. And so it makes it inherently very difficult to scale a product or a service. You take a data product, you want to do something with EMRs. Every hospital has a different EMR. How do you scale a product to meet the needs of EMRs across health systems or across a country? And similarly, the payer provider setup is also broken down. If we have broader insurance cover, if we have a better integrated healthcare system, if we had better access to clinicians, infrastructure, equipment, etc., and that baseline is set, then it makes it much easier for a medtech company or a startup to enter the system and scale up very rapidly. So today, you are restricted or confined to the ecosystem where your particular product is able to play. So your ecosystem needs to burst wide open and then make sense to the overall healthcare system. And this could be across disease areas. This could be, inpatient or outpatient. So I'm trying to make the point here about standardization, data interoperability, and data portability, scale, skill. All of these need to come into play to really make things dramatically scale up in an affordable way.
Thanks, Shravan. Sanjay, any further comments from your side? Because I think, a couple of examples from Novartis where things have been affordable and scalable. I mean, a couple of initiatives. I wouldn't call them necessarily startups, but there are quite a few initiatives that, one talked about, and one of the cases I teach, in healthcare management classes is about this initiative that you guys started called Arogya Parivar, which is all about scalability and affordability at a large scale. Can you talk a little bit from your perspective of the scalability and affordability and quality challenge that we talked about?
Sure, Vishy. I think Shravan touched on a couple of things, but I think one element from a business model and product or service or whatever we call, is supremely important is there's a difference between what is different and what is better.
Yeah.
Those are two different philosophies. And we need to be very clear about that. When something is different, then I think, as Shravan just pointed out, I think the world, especially the healthcare world in India, or actually even around the world, has enough problems to solve. But do we have a different enough problem, and is it the same mousetrap? And if therefore the technology or the service or the idea is very different, I think then the scalability becomes much more easy, because then you have a very clear customer base. Because what usually happens, as we know in the world that we live in, people buy what other people buy. So, you start having something different, people start using the product, and then of course it starts, scaling up. So that's purely from a number one element of being different in what your solution is. Number two, as I think giving the example of Arogya Parivar that you just mentioned, this is a very interesting one, which we started way back in 2007, and now we cover nearly 18,000 villages in India in more than 130 districts across the country. Now here, even though it is a social cause that we do, that we go to these villages for healthcare awareness and providing medicines, especially from Sandoz, which is our generic company, but it is for profit. And when we mean by for profit is that from a business model, intrinsically, what we said is that we do not want to we want to lose money. It's not that we want to make money there, but we do not want to lose money. So once you have a philosophy of that kind, then you start back calculating. Okay, if that is so, what is the number of touch points you need to have, the number of, what is your cost structure that you need to have, and the number of patients that you can work. But I think principally one needs to be very clear. What is your business structure? What do you want to achieve? Is it going to be non-profit? Is it going to be for-profit? Is it going to drive profitability? You want to drive sales or profit growth or whatever it is? So I think we need to be very clear on that, because then you can build a business model and work backwards in what you want to achieve. So that is sustainable. Yeah, and that's why it's sustainable till 2021. We don't put money in, and I think it still continues.
Great. Thank you. I think there's a question that I've been working on for a while now, and definitely love responses from all three. I think if COVID has done one thing, it has exposed the problems with the traditional sales model. In the pharma world or in the med devices world, the role of medical representative or the sales personnel that you're talking about is completely going to be redefined. I think doctors refuse to meet these guys couldn't get access to doctors. So I do see that in this world, if there is a disruption that is waiting to happen, and I think the West is showing a bit of a heads up in terms of how they're managing these sales personnel. So I'd like for your views on what kind of disruptions you're seeing companies make, in managing these sales channels in a very particular way, because I think the mobility of people has been cut short. So this traditional way of going to hospitals is no longer happening, and I hope that this reinvents that entire way in which sales are done. And I'd like your perspective. Any of you could pick it up, and I'm pretty sure all of you have something to add here. So I'm going to toss it open for all three of you.
So I can go first, if that's fine with the rest of the panelists. I think so that three things we found during the COVID pandemic, and I think probably the reflections will be the same from everyone. I don't think we found an issue with the broken model, Vishy. So I just want to make a slight tweak to the comment. I think we found an alternate that existed, which perhaps always existed, but necessity never pushed us to examine that alternate, which was the use of digital in our communications with doctors. And frankly, I would say this, that I think during the COVID pandemic, it is my belief that India as a country did significantly better in terms of reach to doctors, reach to channel, compared to several of the other advanced geographies in the world, right? But I think there is enough of this ability for doctors to be more productive because of the fact that they have, the model has now converged to doctor getting what they want on demand through a digital input. The model has converged. I'll be honest and say that, Cipla is trying to create a Netflix of what we can create for doctors in terms of content in some of our emerging markets in India, right? Because let's not forget the role of the medical rep is also to bring awareness in a system which otherwise does not exist from a pure protocol-based approach, right? So new innovations, and Sanjay will speak about it, or Shravan could speak about it. There's medical reps play the role of taking that information to doctors. So I think we've seen a lot of that. I've seen a lot in channel. I have to say that whether it was the example I gave earlier, or just even basic, something as simple as payments, right, to channel. A lot of them have been digitized. They go through the digital route as against, pure check transactions, right? And I think that's made a lot of difference as well to COVID. So these alternate models existed. I think they became 70% of how we did business during COVID. They'll probably go back to 30%, but a start is made. Yeah. Right. And I think there's tremendous potential. I hope that we can redefine the way we do business in healthcare.
Sanjay?
Yeah, actually, I would like to build on what Umang says. It's so right, because I think the fundamental business problems remain the same, right? I think the question is that, how are you going to, what are the solutions that needed adjustment? So I think very clearly, when we have a patient journey, we still need to find ways to support the awareness, diagnosis, treatment, and adherence of a patient to a disease. And of course, there's this whole ecosystem that is there, which is, I think, so that's number one, sorry. The second one is, I think we need to be aware and really understand what is the rate of adoption and evolution in the healthcare system that we are working on. Because and how do we ensure that the healthcare system, the physicians, the hospitals, the distributors are locked in with this evolution? Because just because Novartis has some fancy tools and technologies, it may not be very congruent with the ground reality of adoption, both internal to the company as well as external. Because healthcare delivery is still a very personal choice. So how do you make it relevant, and that we sometimes are not possibly not go absolutely ahead of the curve of digitalization, as you call it. So I'm very much, what is the space? But I think I just would like to go back to a very specific thing that Umang said, yeah. But the truth still remains that, humans are still social animals. And we have been wired like this for the last million years of evolution. So we cannot easily replace this neurochemical reaction in a face-to-face engagement.
I hope we never manage to replace it. Let's hope that we won't manage to replace it.
Yeah, but at the same time, I think that 70% that Umang said, that's coming back to 30%, the genie cannot be put back, right? It's out of the bottle. So the way I look at it, and the way we look at it, is that the future of customer engagement is a lot like, as my son's favorite Marvel character, which is Iron Man. So it's a very capable, super talented individual who can then harness all of the data and the tools at his or her fingertips available to this individual to create value for his patients or her patients or customers. So I think how can we enable them? I think is really going to be going to be interesting.
Shravan?
Just one thing. I think Sanjay put it really well. Sorry, Shravan, I'll just come in for a minute. One generation where I see all of this coming together is with our children. It's phenomenal how they've been able to adjust with this whole digital part of the world and the personal part of the world. And I think if you want to take a look at what perhaps is going to happen in the future for a lot of the industries, I think these are the guys. Our children are basically showing the way on how some of this could evolve going forward. And let's not forget, they're tomorrow's consumers.
Yeah. Thanks. That's a brilliant point you make. Yeah. Shravan?
So I'll just add to what both of them have said. See, the device space is perhaps slightly different. Of course, we still, need to meet our customers and our clinicians, and we want that dopamine hit when we have that interaction there. But being B2B, and since we sell a lot of large equipment, service is a major aspect of how we have our touch points with our customers. And that, Vishy, has been completely turned on its head, because during COVID 1.0 and 2.0, we couldn't put our people at risk. And so we had a lot of people sitting in front of screens like this, explaining to a customer in a remote location all over the world. Actually, our engineers in India were explaining this to customers all over, how to assemble parts of a CT scan or an MR for a service call. We started deploying AR and VR tools so that, just like the Iron Man example that you gave, it's actually real, it's happening, and we're doing this in service. The second thing, Rishi, in a previous session, I was sharing a panel with the CEO, founder of Medica Bazaar. Right?
Yeah.
Completely turned the industry on its head. Because this is a B2B portal, what the sanctity of the relationship that we held so tight and service, and we were just kind of sitting back. This is the train that he was talking about. It just came from one corner, and it's upended the whole medical device industry in an amazing way, right? In a consumer-friendly, customer-friendly, hospital-friendly way. And now we have to figure out our business model to accommodate that. And find other things to do. Lastly, we also do work a lot with clinicians, and this is where it really gets interesting, because we do a lot of work in the ultrasound space, and a lot of that requires hands-on, hours and hours of hands-on training, to train someone on detecting heart failure or fetal medicine, fetal diseases and conditions. We're doing that through remote simulations. There's actually a box that we're able to send out to our cardiologists or our obstetricians, and basically like a joystick, like a video game, training them on how to detect heart failure remotely. So, and these are here to stay, right? These were cool toys that were in our research shed back in the day, and we deployed them, and now it's just here to stay.
No, thanks. I think that's a great. Yeah. So I really wanted to spend a lot of time also talking about government and all that stuff, but I'm being constantly reminded saying that, the time is already over, and I got a shock of my life when they announced 2 minutes, because I just thought we were warming up. And there's plenty of ground that one could cover. So therefore, I think we'll have to basically end the discussion here, but let me just quickly take a minute to summarize what all we're talking about. We're talking about several things, saying that we are looking at an ecosystem which requires scalability, quality, and affordability. And yes, I think we are talking about business model innovation, and we are really talking about digitization. I mean, yes, I think it's a great idea. But by the way, my son just attended his first class today after the pandemic in the school. I don't think we are ever going to replace human contact with digital. He's just so excited by the time he came home. So going by this, I think what I am understanding is that there's a desperate need to upend the business models, to upend the way we think about going forward, and digital has a great role to play in this entire story as well. And I think how it unfolds is going to be amazing to look at. Some of my research that's coming up is talking about how government intervention, government's increased spending on healthcare is just going to change the innovation ecosystem in the country, not just in healthcare, but all over. And I do hope that some of these things go to the right channels and the right investments are made, not just by the companies, but also by the governments at large, so that we can actually see a very vibrant startup innovation-driven ecosystem for India. On that note, I would love to thank all three of them. I still wish we were meeting physically and we're talking to each other. But nevertheless, I think digital world has its advantages. I don't think I would have managed your time in a physical space, but thanks to Zoom, I'm still able to meet you and talk to you. Thank you very much, gentlemen, for a fantastic set of views from your side. And I apologize to all the audience. I just could not have time to take your questions. Have a great weekend.
Thank you.
Thanks, Vishy.
Thank you, Rishi.
Thanks,
Thank you.
Rishi.
Bye-bye.
Bye-bye.